is Jackie, and I am going to be doing my head to toe assessment on my niece Amy. And we're gonna go ahead and start by inspecting your face, your hairline, and your expression. And right now she is symmetrical. Her eyes, everything is symmetrical on her face. Her hairline is completely symmetrical. Her ears are aligned with everything, and she seems to not have any masses, any protrusions, any scars, or any marks on her face. I am going to palpate your hair, like inside your hair. I'm going to palpate behind your ears and in your neck to look for any masses or any bumps or anything like that. Okay, so I'm palpating her head, and I don't feel any masses or any bumps in behind her ears. In her neck, everything looks fine. I'm going to palpate your sinuses. Sorry for my nails. All right. And that part of the assessment is intact and within normal limits. I'm going to go ahead and assess your eyes. I'm going to check for the light reflex. I want to see your pupils react to the light, and I'm also going to check your ocular movement by testing your cardinal positions, okay? So just look straight to my nose. I'm going to check for your light reaction. And your pupils are perfectly reactive to light. And I want you to look at the pen light, and then looking straight to the pen light. Do not move your face, only move your eyes, okay? All right. Perfect. And her ocular movement is completely intact and well within normal limits. I'm going to ask you to smile. Perfect. And I'm going to ask you to frown, lift your eyebrows, and puff your cheeks. Perfect. So her facial nerve, or cranial nerve number 7, is completely intact. I am going to ask you to tell me, what does this smell like?
Like alcohol, the rubbing alcohol.
Rubbing alcohol, perfect. All right, so that is testing your cranial nerve number 1, which is your olfactory nerve, and that one is testing for smell recognition, okay? Which is completely intact and well within normal limits. I'm going to ask you to take out your tongue and say ah.
Ah.
And your uvula works perfectly fine. It moves perfectly fine. And also, we would be testing at this point the gag reflex. We would put a tongue depressor and see if there's gag reflex. With that part of the assessment, I was also able to see that her tongue is midline and doesn't have any cuts, any protrusions or anything like that. I am also going to test your ability to feel on both of your cheeks. I'm going to ask you to tell me if you feel the same thing on both of your cheeks, okay?
I can feel the same thing.
Okay, perfect. I am going to ask you now to shrug your shoulders while I put pressure on them, okay? All right, perfect. I'm going to ask you to extend your arms like this. I'm going to push them down, and you're going to push them against me, okay? Perfect. And we're going to do the same thing, but the opposite way, okay? I'm going to push them up, and you're going to push them down. Perfect. Now I want you to hold my hands, and I want you to squeeze them really tight. Perfect. Ouch. And that's testing your muscular strength on your upper extremities, okay? I want you to raise one of your legs, or both of your legs, and I'm going to push back, and you're going to push forward, okay? Perfect. Completely well within normal limits. Your strength is perfectly fine. I would give that a 5, being the best, okay? I am also going to check for your pulses. I'm going to auscultate first the carotid pulses, or the carotid artery is better said. Okay. Perfect. And your carotid arteries sound perfectly fine. I'm going to palpate both of them, and I'm going to palpate one at a time, because if I palpate both, I can compromise blood to the brain, okay? And your carotid pulses are perfectly palpable. They are very palpable. I would give that about a 3. I'm going to test your brachial, which is located in this area, and it's about a 2. It's pretty easy to palpate. And your radial, I'm going to give that about a 2 to a 3. It is very easy to palpate. It's very thready. I would check your popliteal pulse, which is located right behind your knee. See? And that one is a little harder to assess, and I would say it's about a 1. It's a little difficult to see. And then your dorsalis pedis, which is right on the top of your foot, and that one is about a 1 also. It's a little bit difficult to palpate, but it's still there. I can still feel it. I am also going to check for your chest expansion when you take a breath. I want you to sit up straight, and I want you to take a deep breath. I'm gonna put both of my hands. I want you to turn this way. This way. No, turn your legs this way, showing your back over here. There we go. I'm gonna put both of my hands on your chest, and I want you to take a deep breath. I'm just gonna see how my hands expand with your thorax and how they come back. Okay. All right. Go ahead. Take a deep breath. Perfect. And that was perfectly fine. Her chest is chest or thorax area is very symmetrical, and it opens with it opens together. I also assess with her that she has no shortness of breath. She is breathing perfectly fine. And I'm gonna palpate your chest real quick, and I don't see any masses. I don't see any. Do you feel any pain when I palpate your chest? No. So sorry. And she has like the symmetrical chest expansion that we had spoken about before. I am going to assess your lungs from the back. And what I'm going to do, I'm going to put my stethoscope in the back of your lungs. I'm going to assess each side one at a time, and we're going to do from the bottom up. Okay, so every time that you feel my stethoscope be put back on a different spot, you're going to take another deep breath. Okay. So I want you to take a deep breath now. All right, take another deep breath. Another one. Another one. All right, now we're gonna do the same thing. I'm just gonna check on your sides. Let me lift your arm here. Go ahead. Let me check this side. Perfect. Now I'm gonna do it again twice on each side. All right, perfect. So her breath sounds are perfectly clear. There are no crackles, no wheezing. Her lung fields expand symmetrically, and the lung sounds are perfectly clear. I am going to do something that's called percuss. So I'm going to tap on my finger on top of your back, and it's basically to tell me whether there is air or whether it's obstructed by something. Okay, so turn that way. And I feel dullness, and that just tells me that there's air in there, and that's perfectly normal. I am going to do now the cardiac part of the exam, and then at this time, as we move into this part, we would be exposing the chest, but for the privacy of my patient, I am not going to expose her chest. I am just going to point to where my stethoscope would be at, and I'm going to verbalize what I should be doing with this part of the assessment. So there's going to be I would be supposed to put my stethoscope on the aortic, around the aortic valve, which is right on the right side in the second intercostal space. I would be putting, for the second one, I would be looking at the pulmonic valve, which is on the left side, right on the second intercostal space. For the Erb's point, which is on the left side as well, is right below that, which is in the third intercostal space. For the tricuspid valve, it's going to be on the left side on the fourth intercostal, and the mitral or the apical pulse, that's going to be in the fifth intercostal, right below the tricuspid. In this part of the assessment, I also would have her, I would also assess her heart rate, laying down, sitting up, and also laying down on her left side so that we could assess both the systolic and the diastolic filling periods of the heart. After doing that, we would actually go ahead and listen to your heart rate for 1 minute, and I will verbalize the your heart rhythm. Okay, so I'm gonna put my stethoscope right here. And after 1 minute of listening, her heart rate right now is standing at 75, which is perfectly normal for a young girl like her and somebody who's athletic, because she's always doing sports. So that's completely normal for you, okay? I'm going to ask you to please lay down that way. And then what I'm going to be inspecting now is going to be your abdomen, okay? I'm going to lift your shirt just a little bit, and I'm going to take a look at your abdomen. I can see that her abdomen is completely flat. She doesn't have any masses or anything like that on her abdomen. She doesn't have any scars or any injuries to it. I'm going to slightly pout. I'm going to, first of all, I'm going to listen to your belly to see if your intestines are moving, okay? Alright, so her bowel sounds are very easily heard. I'm going to palpate real quick. And just doing some light palpation. She's very tiny, and I wouldn't want to overly exert herself. I'm gonna percuss, and there is dullness over the liver, and the other parts I can tell that there's just air, which is perfectly normal. Now I am going to see for get up real quick for me, and then we're just going to do the same thing on your back, right where the kidneys are. gonna pop her cuff real quick. And her assessment is well within normal limits. Thank you.
You're welcome.